Hello, my name is Dr. Edward Fruitman. I'm a board certified psychiatrist. This is going to be a conversation about medications for controlling symptoms of adult attention deficit disorder. The reason why it's important to get the right kind of a diagnosis and the right kind of treatment is that those treatments actually really work well for vast majority of people. And there are different kinds of medicines that are available. There are stimulants and non-stimulant medications, with stimulants being the first line. And let's discuss how that can work. However, it's not the whole solution. It needs to be done in combination with other modality of treatment. So the stimulant medications that are available for adult attention deficit disorder are stimulants and non-stimulants. The stimulant medications are basically divided into two types. The ones that are based on amphetamines and the ones that are based on methylphenidate. So probably the most common amphetamine-based medications are medications like Adderall, Adderall XR, Vyvanse, and medications that are based on methylphenidate are Ritalin, Concerta, and there are several other medications in that group. Another distinction between stimulant medications, there are medications that are immediate release and medications that are sustained release. The benefit of stimulant medication is that it works right away. You don't have to wait. If it works on day one. Now, whether or not a person would benefit from an amphetamine-based or a methylphenidate-based medication would be highly individual. Typically, methylphenidate-based medications are prescribed to younger people, and amphetamine-based medications are prescribed for adult attention deficit disorder. But of course, that is highly individual and needs to be well chosen by a qualified professional. The important distinction between stimulants also is in whether or not it's going to be a short-acting medication with an immediate release features, or if it's going to be a sustained release formulation. Sustained release formulations, such as Vyvanse and Adderall XR, and of course there are several others, were basically originally created in order for young people, school children, to not have to go to a nurse for a second dose, because short-acting medicines only work for anywhere from like 3 to 5 hours, whereas usually a school day or work day is much longer. Of course, other distinctions are that long-acting medications tend to not only work all day long, but also provide a certain kind of a constant level without some of the ups and downs. The drawbacks of long-acting medicines is if a person forgot to take it early in the morning, they cannot take it later on in the day because that would cause severe insomnia, potentially just much more difficult time and functioning the very next day. The drawback of long-acting medicines is that a person doesn't seem to get the kind of a motivational peak or like an increase of performance on as needed basis. And short-acting medicines do provide that. Perhaps the drawback of short-acting medicines is they do result in more ups and downs in both energy level and like maybe certain emotional lability, with a certain letdown or crash effect later on, and generally are a lot more abusable. So perhaps for people who've had difficulties with substance abuse in the past, or people who have to maintain evil and constant social presence and social persona, then the short-acting medicines become less ideal. Stimulant medications for adult attention deficit disorder tend to be the first line of treatment. However, due to them being scheduled to control substances, they present certain difficulties. One is that there is that addiction liability, especially in people who somehow do not have adult attention deficit disorder but have access to those medications. Being scheduled substances, that does require monthly visits to healthcare professional for prescription, and that may be very unattractive to certain patients. The non-stimulant medications then become a very good option. Those medications are a type of blood pressure medicines, like containing clonidine, or an antidepressant type medicines, but some of them highly specific for adult ADD. The first medication on the market for that has been Strattera, and Strattera is widely used, but I think ever since Qelbree has come to this country, medicine has been used in Europe for a long time as an antidepressant. It's easily becoming the new favorite. In my mind, Qelbree does work quicker and with fewer side effects. It's important to mention that there are some medications that are very useful for treatment of adult attention deficit disorder that don't have a specific FDA indication for that. Specifically, Nuvigil and Provigil, those medicines now have been available as generics for a long time. They're so-called vigilance promoting agents. So those are the medications that make a person feel more awake, but do not have some of the liability of stimulant medications that are either amphetamine or methylphenidate based. Benefits of attention deficit disorder medications become quite apparent with stimulants, something that actually works right away. Non-stimulant medications do have a waiting period of like 4 to 6 weeks for the effects to really kick in, but the improvement could be quite enormous in terms of both productivity, attention, concentration, and actually quite paradoxically, in helping control the symptoms of anxiety, because there is a very special kind of anxiety that happens in people with attention deficit disorder. It's an anxiety of being overwhelmed. It's kind of having too many things on your mind simultaneously, and there is that sense of constantly being behind. It's kind of like not being able to juggle things at the same time. So paradoxically, even stimulant medications can make a person who is overwhelmed due to the attention deficit disorder symptoms feel less anxiety and feel a lot more clear. Frequently, people with adult attention deficit disorder who have not been medicated before and who have been underdiagnosed and the symptoms were underrecognized, when they get appropriate treatment within 1 or 2 months, really report that sense of clarity and confidence, maybe not unlike a person who have never been able to see well and all of a sudden putting on eyeglasses for the very first time. The side effects of non-stimulant medication, specifically Strattera and Qelbree, would be that is typical of antidepressant medications of the class. The most difficult thing to get through is some of the initial nausea. If you do feel nausea, then slow down the upward titration of medication, and typically people are able to tolerate it. An important thing to remember for Qelbree is to moderate one's caffeine consumption. It has a specific effect on caffeine by making it last longer. So if you are suffering from insomnia after you tried Qelbree, then make sure you cut down caffeine consumption to maybe 1 or 2 cups of coffee, and only early in the morning. Other medications like clonidine and guaifenesin tend to be very benign, but of course, clonidine is a blood pressure medicine, so one has to initially monitor blood pressure and making sure that you're properly hydrated so you don't feel dizzy. An important consideration, I think, for anybody taking medications for adult attention deficit disorder is an emergence of bipolar disorder. It's not caused by medications, but in case someone does have a bipolar disorder symptoms, then those medications would have to be changed, modified, or discontinued altogether. Another important consideration for monitoring side effects of medication is making sure that you're being monitored by a healthcare professional who's very familiar with adult ADD. If the medications are well chosen and a person is well diagnosed, by and large, those medicines are very well tolerated and are basically worth it. In terms of a long-term use of medication, non-stimulant medications, once the appropriate dose is established, that dose tends to be maintained. With stimulants, we do notice initial drop-off in efficacy, which sometimes leads to one-time increase in the dosing, and then of course, the medication becomes appropriately effective. We always have to observe for constant request or increase in stimulant medications. That sometimes leads to medication being discontinued or changed by the healthcare professional. In our experience, patients with true adult attention deficit disorder do not tend to abuse their stimulant medications because they simply don't find them that rewarding. They work, but there's not a request for constant increase, and there's a lot less risk of misuse or abuse. People who tend to abuse stimulants are people who don't have ADD and have been misdiagnosed. An important difference between how adults and children respond to attention deficit disorder medications is in the fact that adults tend to be self-motivated for treatment and as a result can tolerate medications quite better. Many of our patients who came to see us as adults do have experience of being treated as children, but they frequently felt forced to take those medications by grown-ups. And, obviously with a typical adolescent rebellion that ensued, and they did not see the benefits of the medications. So a lot of times, if you had a negative experience with attention deficit disorder medications as a child, it does not mean that you would have the same experience as an adult. Frequently, if you have difficulty functioning, it's worth taking another look. Of course, the type of medications are also different. Adults frequently do respond better to amphetamines whereas children respond better to stimulant medications that are based on methylphenidate. Either way, for adults or children, it's very important to be diagnosed and treated by a well-qualified professional who is constantly monitoring for both efficacy of medication and side effects. In summary, there are many options for treating adult attention deficit disorder. They're both stimulants and non-stimulant medications. So they're both controlled and non-controlled substances that are available and are highly effective for treatment. A word of advice for people who've had negative experience as children taking medications. As an adult, if you have difficulty functioning due to ADD symptoms, it's worth taking another look because adults sometimes have a better experience of trying it the second time around under their own auspices and their own free will. Another important consideration is getting the right kind of a treatment team and the right competence of a provider, because adult attention deficit disorder is something that has not been as well studied and or as well taught. So healthcare professional has to have experience with this particular condition. Remember that medications is not one and only answer. I think it's best combined with psychotherapy and or coaching approach to certain important lifestyle changes. Thank you for listening and viewing this video. Please subscribe to our channel. If you have any questions, please pose them to us in writing so we can make it a part of our next video.